Mycobacterium tuberculosis. Introduction. Tuberculosis, often abbreviated as TB, is a potent bacterial infection that primarily affects the lungs. This persistent disease is caused by the bacterium Mycobacterium tuberculosis. While it is curable and preventable, it remains one of the leading causes of death worldwide, particularly in developing countries. Its destructive potential is amplified by its ability to evolve into drug-resistant strains, making treatment more challenging. To comprehend the magnitude of this health issue, it is important to delve into the specifics of its transmission, the statistics underpinning its global impact, the symptoms and treatment options, and the measures that can be taken to prevent it. Transmission route. TB is known as an airborne disease, meaning it spreads through the air when a person with active TB disease in their lungs coughs, sneezes, speaks, or thereby releases bacteria into the air. Unlike some other infections, TB is not spread by physical contact, such as shaking hands or through the touching of any object. However, the bacteria are so tiny that several thousands of them could fit into a single grain of salt. The minute size of these bacteria make them easy to inhale, which is why close, prolonged contact with an infected person, such as living in the same household, increases the risk of infection. Not everyone who inhales TB bacteria becomes sick. The body's immune system can often successfully fight the bacteria, resulting in latent TB infection. In these cases, the bacteria remain in the body in an inactive state and cause no symptoms. If the immune system cannot kill or contain the infection, it becomes active TB, the most common and dangerous form. Statistics. Tuberculosis still remains a major global health issue. In 2022, the World Health Organization reported approximately 7.5 million TB cases worldwide, with 1.3 million fatalities. TB affects all countries and ages, but is most common in low to middle income countries with limited healthcare. The countries with the highest TB burdens are India, Nigeria, South Africa, the Philippines, and Pakistan, highlighting the need for ongoing efforts, especially in resource-scarce and high-prevalence regions. Symptoms, cure, and response. Common symptoms of TB include a persistent cough lasting 3 weeks or more, chest pain, coughing up blood or sputum, weakness, weight loss, lack of appetite, chills, fever, and night sweats. Not everyone with TB shows symptoms, especially those with latent infections. TB is curable and preventable with a standard 6-month antibiotic regimen prescribed by a healthcare provider. Completing the full course is crucial to avoid drug-resistant TB from forming. Multi-drug-resistant TB, MDR-TB, and extensively drug-resistant TB, XDR-TB, are increasingly challenging to treat and have poor outcomes, posing significant obstacles to TB control efforts. Prevention. Preventing TB demands for a diverse approach. Early detection and treatment of active TB cases is crucial to preventing the spread of the virus. Vaccination. The BCG vaccine is administered to protect against severe forms of TB in children, although its effectiveness in preventing adult pulmonary TB is variable. Identifying and treating latent TB infections in individuals helps prevent progression to active disease. Public health initiatives addressing poverty, malnutrition, and overcrowded living conditions are vital to preventing TB. Addressing broader factors like HIV, diabetes, smoking, and alcohol consumption is essential for comprehensive TB prevention and control. Conclusion. Tuberculosis is a significant health threat, especially in areas with limited healthcare resources. However, with early detection, proper medication, and appropriate preventive measures, it's entirely possible to overcome the disease. Continued research, education, awareness, and visioned public health measures are crucial in the global fight against TB. The battle against TB is not only about treating the disease, but also about improving the living conditions and health systems that contribute to its spread. It is a battle that requires the collective efforts of governments, health professionals, and communities in order to create a TB-free world. Together, we can finally make this disease a thing of the past.